Spinal Truth Show Weekly Podcast Edition. I am Dr. Caleb Slater. I am joined here with Chris, our videographer and color commentary, and Jill, social media expert. We are here to give you a different take on a lot of conditions out there, a lot of symptoms and conditions that are often getting misdiagnosed and mismanaged in the medical system. And today's topic is Crohn's. So what an inflammatory topic we have to talk about today. And I mean that fully pun intended, right? I mean, it's a shitty inflammatory topic, right?
Yeah.
So Crohn's is something interesting. If you asked me 4 years ago, and I've been doing physical therapy, I've been in the medical field for about 16, 17 years. If you said 4 years ago that I would be doing a podcast and talking about how I treat Crohn's, I would have been like, well, no.
Yeah.
And so it's something that kind of came about almost by accident. So it's an interesting story. But since we discovered that we can affect most people that have Crohn's and their symptoms by treating the areas of their spine that innervate their intestines, their stomach, and not only affect their symptoms, but actually get them to the point where they don't have any symptoms and are now off medication. Since we started finding that about 4 years ago, it's been pretty consistent with the patients that I've seen, and it's been really cool progression to see this treatment play a part in not just Crohn's now, but other GI issues like ulcerative colitis, IBS, gastroparesis, diverticulitis, a lot of these conditions out there that people have that they're really not getting any type of true treatment. They're getting mostly just management of their symptoms.
Yeah, Crohn's for me, as a layman, is one of those diagnoses that you hear, like my cousin has it or something like that, and it's like fibromyalgia, where it's like not quite understood what exactly they're dealing with, but it's a whole host of symptoms, and yet I know that they don't have a specific treatment plan for them.
There's not a specific treatment plan.
It's their life now.
There's not a specific cause. There's not a specific presentation of symptoms or findings. There's not a specific test. So basically, if you put that in, layperson terms, right? There's not a test. There's not an underlying cause. There's not a true telltale symptom. And there's not treatment. Maybe we don't fully understand this condition or variations of this condition that get misdiagnosed and then mislabeled. Mm-hmm. And I think that's the main thing that we're trying to get across here. I'm sure there is an autoimmune response where somebody has their body is attacking their digestive tract, and that is the true quintessential Crohn's, right? However, I think that's fewer and farther between than we realize. And, how many people, when you were growing up, we grew up in the 80s, right?
Yeah.
How many people when you grew up had celiacs?
No one.
No one.
Yeah.
Right? I never even heard of it.
Never heard of it. Yeah.
And now all of a sudden, everybody has some form of gluten intolerance.
Yeah.
Right? I feel like Crohn's is kind of going along that process as well. Like Crohn's was discovered, I think, in right around the 40s.
Okay.
But it still wasn't well understood or applied. And now all of a sudden, more and more people are having GI issues and they're getting labeled with something. Mm-hmm. And again, ulcerative colitis, IBS, Crohn's, those are probably the big three.
Yeah. Yeah, there's a whole host of things that go along with that if you break it down though. So I'm like, the celiac thing with gluten intolerance, that is something newer, like in the last 15, 20 years maybe.
Feels like it.
And I don't know if that's a case of scientific discovery or medical advancement or in the change of diet and all that stuff revealing itself in these new.
That'd be where I'd put my vote, the change of diet.
I would also ask too, I mean, you said you grew up in the 80s, and like I even grew up late 90s, early 2000s. And when I was younger, we would play outside all the time. We were more active. And I'm also wondering if maybe,
environmental factors,
right? The movement of your spine, if there's innervations from your nerves into your organs, I wonder if your activity level plays a difference in that too, or if it's just inflammation from food, et cetera.
And you bring up a good point. So on this show, we talk about how your spine plays a role. Your spine and its nerves play a role in your body's functions, and not just your joints and muscles and tendons, but also your internal organs, your intestines, your stomach, your spleen, your heart, right? So we have noticed that increased tick of people getting these symptoms, but we've also been a more sedentary society. And I mean, that sedentary rate has skyrocketed specifically since COVID. And I feel like since COVID too, which was 4 years ago now, you're seeing these diagnoses pop up more and more frequently, at an elevated frequency as compared to COVID, before COVID. Now everybody works from home. Now you don't even leave your house to go get food anymore. Yeah. I mean, you DoorDash or Uber Eats
for sure.
stuff to your house. You barely even have to get to the door, to get a meal.
No, yeah, lifestyle changes have changed dramatically in like the last 20 years.
So for the people at home, what are we talking about? Why could your spine cause these symptoms? And I guess we should get into some of the nitty gritty, the specifics. So somewhere around the T5 to L2 area of your spine has innervations to your intestines, your colon, your large intestines, small intestines, your ascending colon, your stomach. All of these areas are innervated by your spine. And if these nerves, some of them or all of them, aren't getting the proper signal, and not even just like the full signal, but as strong of a signal as it's supposed to, those areas aren't going to function properly. And what does that look like, not functioning properly? Well, your digestive system is supposed to move waste and promote nutrient exchange. Mm-hmm. If you can't move waste properly, you also can't get nutrient and fluid exchange as well. So any of these symptoms that present with Crohn's can be presented with this problem as well, and this would be abdominal pain, cramping, nausea, chronic diarrhea, fatigue, vomiting, weight loss, joint pain, bloating, even blood in this area can be due to chronic inflammation, which is caused by not moving waste. As this waste sits, it can also cause bacterial overgrowth. So SIBO, I don't know if you've heard of that. Small intestinal bacterial overgrowth. That's another one that now just keeps popping up everywhere. SIBO.
Nope.
SIBO. So if it sits, think about it, if your waste sits in your intestines, right, for longer than it should and is fermenting in there, you might get bacterial growth. Now this bacterial growth causes an inflammatory response. So now you get inflammation, and now that inflammation, when it gets observed on MRI, CT scan, colonoscopy, it's blamed as an autoimmune issue rather than what it is, a symptom of an underlying problem. If you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your symptoms are there in the first place, and we expect quick improvement. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you, and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show.
So 2 questions for you. One, is there a specific way where you can diagnose that there is a spine problem with those nerves?
Okay.
And 2, is there a way that they have to say that you officially have Crohn's? Is there a test you take?
All right, let's go number 2 first.
Okay.
There is no standardized test finding for somebody that has Crohn's. It's a cluster of symptoms, basically how you present, what are your symptoms, and it's ruling out other things that could present like it, like ulcerative colitis or an infection.
Gotcha.
Right? So there is no standardized test for Crohn's. So people say there's genetic components, but I think about only 10-15% of people that have these genetic factors actually end up developing Crohn's. So
okay.
it predisposes you to possibly having Crohn's more likely or more readily for whatever reason. And we should talk about that too. Why if they're there, if it predisposes you to what then ensuing factor, catalyst, right?
Yeah, right.
And we'll talk about, the rationale for that. But then when you go to your doctor, it's just basically symptoms, ruling out other findings, and then possibly observing some inflammation, bleeding, ulcers on a colonoscopy, MRI, CT scan, and then you get labeled with Crohn's.
So it's just, we know for a fact that we can test for certain things. So we
Correct.
Can remove those once we do those tests.
Yeah.
And so you still are left with a whole bunch of symptoms, and they say, well, it's not these things, so it has to be
So
Crohn's.
it's likely this. And, and I write in the book that you could take your knee pain and you can go to 5 different doctors and get 7 different diagnoses.
Right.
Right? You can take your knee pain and you can go to one doctor and it's a meniscus issue, another doctor and it's a muscle firing issue. You go to another doctor and it's osteoarthritis. You go to another doctor and it's RA or chondromalacia, right? All right, any of these symptoms, and basically whatever this doctor has primarily seen, whatever they naturally tilt towards in diagnosis, whatever their previous experience is, that's going to help guide their diagnosis. Same thing happens with other conditions too. So, and like what you said, once they've ruled out other things, this is what best fits, but doesn't necessarily mean that is what it is. And for the people at home too, if you've had this, if you've been through this process, did anybody take a look at your spine? Did anybody even mention, hey, this could possibly be a spine issue, and a problem in your spine could cause all these same symptoms. Let's rule that out as well in this diagnostic process. And I'm going to almost guarantee you, nobody at home is going to say, oh, absolutely.
Yeah, no, I mean, I've dealt with like depression and anxiety my whole life, and that kind of treatment feels very similar. Insofar as you say, I feel this way, they'll automatically put you on some sort of drug. They'll test you on that drug, and then they'll say, well, it's not quite working for you, so we'll switch it.
So they'll switch.
And as like just the patient, I'm like, oh, I guess that's how that works. Only certain things work for my body. But that doesn't sound right either. So
Right. Well, and you talked about fibromyalgia. Fibromyalgia used to be the catch-all, right? If they couldn't figure it out, you had fibromyalgia. If you had global pain or symptoms that they couldn't figure out, they couldn't put it to any other label, then you had fibromyalgia. And now you had a diagnosis, but the diagnosis was basically, we don't know what it is, so here you go.
Well,
and I feel like anxiety has become that.
Right, and it was like, find a drug that takes away those symptoms for you.
Modulates those symptoms.
Modulates those symptoms, but go off that drug or stay on it long enough, the symptoms return.
Right. Your body gets used to it magically. Your body gets used to it, or the drug stops working, or any other rationale that they're going to give you. And so it probably wasn't the right treatment in the first place.
Exactly.
So back to your question number one.
Yeah.
Is there a way that you can tell that somebody's spine is causing Crohn's? It's kind of a yes and no.
Okay.
So again, there's certain areas of your spine that innervate your intestine. And based on these areas, I know what patients are going to have difficulties doing. So let's say the TL junction is one of the biggest areas for these patients. So it's where your thoracic spine changes to your lumbar spine. It's just a terminology for a part of your spine. This area strongly innervates your intestines. This area also innervates your hips. Okay, your hips, groin, stuff like that. So I know that these patients are going to have typically some hip pressure, pinch sensation. They're going to have some hip pain, thigh pain, stuff like that, because this area also innervates that. Some local back pain too, wherever this area innervates, which is kind of like a inverse V in their back. Also, when they're in person and they see me, I push on the individual levels of their spine. I've pushed on, I don't know, let's say 50,000 spines.
Okay.
I know what normal is and what normal isn't.
So that was going to be my question. Do you physically feel a difference in the spine, or is it the response from the person?
It's both.
Okay.
You need both. And honestly, you go more by the patient's response, right? Like the spinal segment can move, quote unquote, normally. But if there's pain at that area or an abnormal amount of pain, then it's positive, right?
Yeah.
Then it's an involved segment. So you can go by how stiff it is or how painful it is or both, or even the position of it, right? But typically pain is your guiding factor, the patient's response. So if they're painful or abnormally painful through these areas with less amount of force than should take to elicit these symptoms, right? Then you have a pretty good idea that these areas are involved. That plus the findings of their evaluation, and again, how they move too. A lot of these people, they can't squat down fully. If they stick their legs straight out, they have some nerve tension. Like they have some other clusters of findings that present with a back problem, but then they don't necessarily get then correlated to their gut and GI issues.
So does a healthy spine have that pain sensation?
No.
Potential?
And so I show them. Basically any patient that comes in, I'll push, and I start at an area of the spine that I think is uninvolved, right? So let's just say we're saying T5 to L2, so I'll start at T2, and I'll press on that area and I'll say, how's this feel? And they'll say, normal, just like pressure. And I'm 200 pounds and I'm putting my weight on them, right? I'm not going easy. And I say, all right, well, just let you know, this is what a normal healthy area should feel like, right? Now we're going to start moving down. And as we get to these areas, it ramps up to the point where all of a sudden now I'm putting barely any force and they're in a 8, 9 out of 10 pain. And then, so I used to just kind of go at those areas and they say, well, that, that would hurt if you did that anywhere, and then I'd have to go. So now I start in an area that's pain-free, or hopefully pain-free, or uninvolved, and then I move to the more likely involved areas.
So a portion of this diagnosis then is almost black or white insofar as you can determine if a section of the spine has potential issue or nerve pinching or whatever you want to call it going on.
Correct.
Then from there, from your education what that usually innervates in your body, innervates.
Correct.
And so you're kind of working backwards.
Yeah, and the cool thing is that I don't go into an evaluation expecting one thing or another. I don't go into treatment expecting one thing or another. I wait to be surprised. Did they get better? Did they not respond? And then kind of work at it there. But I look for changes orthopedically first, because that typically means I'm on the right track. So what that means is that if I'm working the TL junction, and again, which innervates kind of the groin and hip, if they're having groin pain, hip tightness, stuff like that, I expect to see that change at least somewhat within the first visit, but relatively well within the first week or two. The internal symptoms, the GI symptoms, they typically take a little bit longer to change. This has been going on for a while for these patients. And you can think about it too, if the nerve signal finally does get improved, now there is still some healing to be done.
To the organs themselves.
Right.
Yeah.
Now the body's getting used to moving that waste. A lot of times people will actually have increased diarrhea for the first week or so. And then all of a sudden, then it's normal. If you're out there and you're in pain, if you're tired of the current medical system failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way, look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system, and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio.
I was going to ask too, because I know you've had patients where they come in for shoulder pain and then they start pooping more or something like that. Is there anything that people might not think or equate, my Crohn's is getting better, but I have this really bad back pain, or like I know some people have had joint pain or something like that?
That's a good question. So lower leg symptoms we've noticed in a lot of these population, and a lot of the people that have Crohn's, and so were diagnosed later. They initially started, they had some back pain, and I mean, everybody goes through back pain, right? So you kind of, once it goes away or diminishes or your body gets used to it, you just kind of put it out of your mind. But then all of a sudden you get some hip, thigh, knee, or even foot and ankle symptoms, and you forgot that you had back pain, and you didn't know that the back can cause these problems. So now you go to the doctor for your hip and they say you have a labral tear, or you go for your knee and they say you have a meniscus or chondromalacia, or you go for your foot and they say you have plantar fasciitis. But the treatment of those areas doesn't really do anything for it. And nobody can figure out why. And it's because you're getting the wrong treatment to the wrong area, and they didn't correlate your back problem to these areas. As this progresses, now you start to see some of these GI issues. When I start treating these patients, you tend to see these symptoms start to reverse. And some of the earlier signs that we see is less pain in the foot, their plantar fasciitis goes away, if they still have it at this point. Some bathroom habits change, and change could actually mean worsening at first. So again, at first, if we're working on an area that is affecting the intestines, any change is a positive. It means we're in the right area. And again, we also expect it to be temporary. One of the earlier changes in the younger population we see is that they stop waking up at night to have a bowel movement. And for whatever reason, it seems to be more common in the younger population, but they're, somewhere between 8 and maybe 14, 15 years old. They're waking up in the middle of the night once or even twice to have a bowel movement. This is one of the earlier signs to change internally.
Okay. So in theory, if someone has Crohn's and they do have an autoimmune disorder, would working on their spine, say they have a spine issue too, could that potentially
It
either
could
help
it could
with the
help.
symptoms?
Yeah, it could help with the symptoms. It probably wouldn't take it away, but I mean, it's the same as taking your Humira, Skylara, Stelara,
Right.
Skyrizi. It helps with the symptoms, but it doesn't do anything to affect the underlying cause. Any amount. So we talked about like the gluten, right? Like maybe we were always a little intolerant towards it, but our body wasn't amped up to the point where it couldn't handle the load. But now with all the sitting and the processed food and stuff like that, that little extra kick now causes a response. It's kind of the same thing. You're a problem in your spine, and specifically, we didn't talk about it yet, but an issue with the vagus nerve or the area where the vagus nerve travels can cause an inflammatory response. Even if your spine is causing less motility of your intestines, that can lead to an inflammatory response. Now, if you have Crohn's, right, or if you're genetically predisposed, right, your body's response to this increased inflammation could be harsher. Okay, so now that you have this more aggressive response to inflammation, you have more symptoms than somebody that doesn't have those predisposing factors.
I think that's a really good point you just made too, because I was reading about, I don't have Crohn's, so I was just curious, like, with celiacs, people can't eat things like gluten. But when I was looking at Crohn's, it's people can't digest meat, they can't have vegetables. Like, it's like every single food group. And I was like, that's kind of weird that there's not a common type of food that people with Crohn's can't have. It just seems like it's all over the board, whether it's greasy, whether it's something that we consider to be healthy. So I think that kind of points to that connection with the back.
Well, and so we talked a little bit about the varied presentation of Crohn's, right? So, some people can't eat greasy food, some people can't eat cheese, some people can't eat gluten, some people can't drink alcohol, and it just changes. We talked about the varied presentation of Crohn's, where some people it's more nausea and vomiting, and some people it's more diarrhea, some people it's actually constipation, some people it's abdominal pain and bloating, some people it's all of these. So why is it some people it's in the lower colon or in the small intestines or the large intestines? So why do we have these varied presentation? And an explanation for that from the spine perspective could be that, again, multiple levels of your spine contribute to these areas. So let's say we said T5 to L2, so that's 9 vertebrae, 9 spinal levels that can contribute to your intestines. Well, let's say for me, I have the lower 3 of them, and I get symptoms because of the lower 3. But let's say for you, Joe, you have the upper 6. So your symptoms are going to look a little different than mine, even though we're still getting the same nerves, relatively speaking, are getting irritated and going to the same area, but we're going to look a little bit different. So for my money, your spine can actually explain this variable presentation and symptoms.
That's so interesting.
So something that I hear about from Crohn's people is that they get flare-ups. What do you think that is if it's...
So again, I'm a spine expert, right? I'm the spine guy. From
your perspective. Yeah.
I can explain that via the spine as well. Disc issues in general are known for their variable presentation. Your disc material can kind of move. You reuptake fluid at night, so your discs are literally thicker and stiffer in the morning when you wake up, and they're thinner and more mobile towards the end of the day, okay? You can put more pressure sitting, you can put pressure on the front of the disc and moving material to the back. You can stand up and walk or do a bunch of back bends and put more pressure on the back of the disc and move the fluid to the center. The disc moves, so you can get some pressure on the disc, you can get some pressure off. You can sleep in a weird position and kind of kink your body, right?
Yeah.
You could put pressure on the disc and now it's not removed for a long period of time. This can explain that remission, so to speak. Right? And at least at first, maybe at the beginning of their symptoms, it was kind of like, and I think most people, at least my patients, they've said this too, at the beginning it wasn't constant and severe.
Okay.
But it progressively worked its way up to more and more consistent. When they did have their flares, the flares were lasting longer and being more intense, and slowly and slowly and slowly it worked its way to basically constant. That would explain it for a nerve issue too, where you're putting some pressure off, you're taking it off. But the reason you're putting pressure on the nerve is because you're doing the same thing over and over again, and eventually your body gives way.
And this might not be related, but question. I had to have my gallbladder removed. I remember the gallbladder being in intense pain but it was in my back. What is that because?
So it can be, right? Like
Okay.
an area of the spine innervates the gallbladder. I think it's somewhere around the lower thoracic.
Okay.
I think T8 to T10, somewhere around there. Don't quote me on that.
Yeah.
So, and the whole point of this is just giving people a different perspective. So let's say you did have an inflamed gallbladder. Why was your gallbladder inflamed? Can anybody explain it? Mm-hmm. If you have inflammation in your colon, why was there inflammation? Can anybody explain it? I can kind of give you a pretty good explanation for why the inflammation was there. You know, the nerve wasn't getting the intestines weren't contracting properly, the waste wasn't getting moved, bacterial overgrowth and basically stasis of your intestines led to, it can even lead to like necrosis and ulcers. And now all of a sudden you get inflammation. Right? That explains the cause of inflammation.
Yes.
And in my mind, in a pretty linear, logical way. And I'm not saying this is everybody, but I'm saying this is very possible. And from what I've seen, it's a lot more prevalent than people realize. And again, if you're out there, did anybody look at your back? And I can almost guarantee it's a no. Same thing with gallbladder. Like, so if you go and you have an infection, right? That explains it. So if you get medication for that infection, you get better, and then you shouldn't really have those symptoms again.
Right.
But let's say they can't find a reason why. They can't find an infection. They can't really give you an explanation for why the gallbladder is inflamed. All right, possibly look towards the spine.
Well, my question for bringing that up was that, like, the pain that I felt wasn't actually where it was happening. It was in my back. So my question would be, if people who are suffering from Crohn's, are they also experiencing back pain symptoms?
So it's a good question. Often, so I think it's been a mixed bag, to be honest. And the way a lot of this came out was that I already had this mindset if you came to me for your orthopedic issues, right? So if you came to me for your hip pain, knee pain, ankle pain, shoulder, elbow, wrist, right? I mapped out your symptoms, but then I looked to the area of your spine that correlates to these body parts to see if there was a problem. And the more I looked to this, the more I found at least a contributing factor, if not the underlying cause. And I was able to take away these patients' pain and symptoms not only more quickly, but more permanently, right? And I never really applied that to more lifelong internal symptoms like Crohn's, ulcerative colitis, so it was kind of a one-off. So the point was, like, I already had that mindset that led me there. Most people don't have that mindset, though. What was your original question here? I think I got off track.
Oh, it's just the fact that when I was experiencing the gallbladder pain, it was mostly my back.
So the point of me saying that was, sorry, it was a long explanation, was that a lot of the people that come with knee pain, they don't have back pain in that area. They don't realize it. Or they had it so long ago that they forgot about it and they didn't associate it. That being said, now that we're talking about this online a lot of the people are reaching out and saying, when my back acts up, so does my GI. So they're noticing that cause and effect, which is really cool. They've also, I did a short saying, the people that have had their back pain treated or their GI symptoms cured by treating the back, please reach out. And we've had a pretty good reach out from those people as well, that they notice that when they go to their chiropractor and their chiropractor works on their back, their GI symptoms are better.
Yeah. Well, and we talk about something similar with plantar fasciitis, where it's like we have the memory of a goldfish. We could have had back pain a year ago, but now the pain has moved down to our knee, down to our foot. And once you start working on their back, the pain from their foot now moves back to their knee, and it kind of reverses back where the pain was. So it's potentially like someone with Crohn's could have had some back pain years ago.
And the medical system does a really bad job in general of looking at your body as a whole, of treating you holistically. I mean, and when we hear holistically, I think we're getting better, but it used to be you'd picture like flower power and henna tattoos and hemp and whatever holistic means to you.
Right.
Now we're noticing that like natural approach is getting more and more in vogue, because I think we're realizing that the medication route isn't really doing anything to address the cause. It's just managing your symptoms, and now you have a whole bunch of side effects from the medication. Now you have a whole bunch of side effects from the underlying cause not being addressed. It's.
But what you're talking about is holistic, but it's like goes back to like a mechanical approach of the way your spine functions.
Right. Yeah. I'm very black and white, right? So, there's people that are the glass is half full, the glass is half empty. I am like, look, let's measure and we'll tell you exactly where the glass is, and that was kind of my point earlier when I said I don't really have expectations when I'm treating anybody. I know what I've done in the past that's worked, and I wait to see if it works or if it fails, for these patients. So I try really hard. I've worked with other clinicians that, they'll incept you like, oh, don't you feel better? And like, you're going to feel so much better after this. I don't do any of that.
Coaching of the
no coaching, because it doesn't give any value to me if they're fakely better, right? And because eventually their symptoms are going to return, and then that didn't do anything for me or for future patients, right? So I don't want people to get better just because they think they're better.
Yeah, but okay, so along those lines, if you have Crohn's, the worst case scenario of getting your back checked and treated is potentially it could help your symptoms or maybe even cure them.
Yeah, I mean, unless you did something wrong,
right.
To the back. If I did like dropped the people's elbow on the spine.
That's not the treatment method
That's not the treatment method. That's a Razor Ramon reference there for the people out there.
You know what I mean? Like, how many people with Crohn's end up getting surgery?
Or not Razor Ramon, that was a rock, but.
That's okay.
How many people with Crohn's end up getting surgery? I looked it up recently. It said 70 to 80% of people with Crohn's will eventually have surgery.
Yeah, see, that's a life-altering thing. And I guess my point is, like, before you go that route, just consider maybe checking the spine.
Well, and some people get that surgery and then they still have the same symptoms. So now you did all of that for nothing.
Or worse. I mean, now you're left with more pain, scar tissue, a colostomy bag, ileostomy bag. Well, and so you ask, like, what's the negative about getting your spine checked? Well, the one negative is that nobody knows how to do it. Unfortunately, I am one of the few or the only that has this approach, and I'm trying to get this treatment method out there, but it's slow. It's slow to get out there. Number two is, I mean, it takes time, effort, and money. I don't accept insurance. I got away from that a while ago. So it takes a leap of faith and some money. And then it goes back on your part. Most of the time, the people that I see, I'm seeing them over telehealth. I'm seeing them from a state away, a country away. And because of that, their recovery is dependent on what they put into it. I can show them how to take pressure off their nerve. I can show them what exercises they need to do, but they need to do it. And then the time, most of the patients, if not all of them, most of the patients, by the time 5 weeks is up, they're somewhere around 50% or more improved. And that's typically what I advertise, or I'll tell patients, like, this is my goal to get you there. But 5 weeks when you're working on your back, your symptoms day in, day out, that it sounds like a short period of time, but it's a lot of effort.
No, it's a commitment. It's a commitment. Starting to working out isn't always fun, but
and there is no guarantee.
Yeah.
If anybody offers you a guarantee, they're either lying to you and or to themselves, especially in the medical field, right? But from what I've seen over and over and over again, every patient that has come to me that I've been able to evaluate in person has had the same tenderness to the areas that innervate the intestines, and then most of the people that I've worked with have had the same response, where it's somewhere around 5 weeks. They're 50% or more improved. And 50% or more improved with these symptoms is life-changing.
Yeah. Oh, definitely.
Right? A lot of the patients, when they have a flare-up, at least, they're going to the bathroom 12, 14, 16 times a day. They're having bowel movements 12 times a day. Think about what that looks like if you want to go out to, let's say, a ball game.
Yeah, no.
Or a movie.
Right.
If you want to go stand in line for something, right? Like, you have to be worried about where there's a bathroom. There's an embarrassment factor. There's a privacy factor. If you're out and about, there's a cleanliness factor. I don't want to use a porta potty.
No.
In Jill, you asked this question about what are some of the first symptoms to change. Frequency of going is another one. Going from 12 to 4 to 2 bowel movements.
Which I'm sure that just has like an insane change on your quality of life. Like, there's such a stress factor in that too, of like, where am I going to find a bathroom? Like, it makes you not want to leave your house, essentially. Like, I know people who have had to just start working from home because they can't.
I've treated people who they work from home because of their condition. I've treated young kids who have a special pass at school that it says whenever they get up, they can
Let
go
'em
to the
go.
bathroom
Yeah.
because they got to go.
Yeah.
Well, since we're getting close on time, maybe a good last question for you would be, because I know we get pushback on social media and we get pushback on some of the things we say about Crohn's. So are you saying Crohn's doesn't exist?
No, I'm not saying Crohn's doesn't exist, but I'm saying because there's no cluster of symptoms, because there's no firm diagnostic tests, because there's no known cause, and when you list the causes are, I think, about 9 to 10 deep, ranging from genetic to immune to your gut microbiome to your diet to smoking to geography to stress and other, right? So if there's no known cause, there's no known treatment, there's no specific test, I'm saying that it can be misdiagnosed fairly easily. And I'm saying that all of the same signs that Crohn's presents with can be from a spine issue. And I'm saying that the patients that I have evaluated have had a spine issue in the area that can correlate to these symptoms, that supplies their intestines, their stomach. And the patients that have stuck with this treatment, I've had some that have done, one and then that was it. I've had some that have just done a consult and they haven't come back. But the patients that I have stuck with this treatment for 5-6 weeks, they've had relatively significant improvements, somewhere around 50%. And I've worked with patients who have gone past that, and they've been able to come off of their Humira, their Skyrizi, their Stelara. They've been able to come off of their long-term prednisone, which shouldn't be used long-term, because they've been symptom-free. So if that's the case, it was very, very likely they were misdiagnosed, because it's so easy to misdiagnose these symptoms for the reasons we laid out. Not only that, but they also strongly intertwine with other conditions like ulcerative colitis, IBS. So I'm not saying there isn't Crohn's. I'm sure there is somebody out there that has an autoimmune response to their GI tract, that is, your body's abnormally attacking itself. Fine. If that's the case, though, the biologics should work very well. The anti-inflammatory treatment should work and work, or the immune therapy should work and work very well. But for most of the people out there, these treatments that are getting applied are Band-Aids at best, incomplete treatments, lifelong incomplete treatments that aren't doing the job, that aren't even getting close to 50% relief. And so if that's the case, now you should be asking yourself, all right, well, maybe there was something else, something that you didn't realize, and something that the medical system right now doesn't do a great job of recognizing or evaluating for. So that's our show for today. Again, we are a unique show that talks about just a different perspective in the medical field, different perspective than you're going to get from your doctor, your local physical therapist, your chiropractor. And it's a perspective that has been molded over the years of just ineffective treatments, the same ineffective treatments that you're noticing with the medical care that you're getting. So if you're out there, if you have questions for us, if you want a consultation, if you want to visit, you can go to thespinaltruth.com. If you have questions that we didn't get to today about Crohn's, you can leave us a comment down below. You can also reach out to us on TikTok and Instagram, as well as Facebook. We are here for you. We're here to answer your questions. Leave us a comment, ask us, and we'll do our best to get back to you. We will see you next week talking about hamstring issues and other sports-related problems that occur in celebration of the beginning of football season.